Good afternoon, everyone. So my topic is TRAMB, that is transcutaneous retrobulbar amphotericin B injection as an eye saver in post-COVID-19 rhino-orbital cerebral mucormycosis cases. So rhino-orbital mucormycosis is rapidly progressive in the absence of treatment and has a high mortality. And currently for orbital involvement, exentration is only the available treatment in the cases which have no light perception, and that is done to limit their intracranial extension, and other orbital modalities are limited. So exentration is not a viable option in eyes which have useful vision or limited orbital involvement, and it also causes extensive disfigurement and psychological trauma to the patient. So in such cases, we evaluated whether retrobulbar amphotericin B can be a useful alternative, as there are limited number of studies in this area. So our aim was to assess the outcomes of TRAMB injection in ROCM cases as an adjuvant to standard systemic antifungal therapy. So it was a prospective interventional study, and the inclusion criteria was all the ROCM cases with stage 3B or more, whether clinically or on radiological orbital involvement. The no PL eyes and the eyes which have received any treatment were excluded, and all the patients received TRAMB injection for 7 consecutive days, and their clinical and radiological parameters and demographic and systemic status were noted. The patients were followed up for 3 months. So there were 44 eyes of 42 patients, and 2 patients had bilateral involvement. All the patients received intravenous amphotericin as the primary treatment, and all the patients underwent surgical debridement, including FES, maxillectomy, and endonasal debridement. So the mean age was around 52 years, and there was slight male preponderance of 2.1:1. Systemically, there was wide prevalence of diabetes, and as around 70% had diabetes mellitus, 50% received some form of steroids, and oxygen was given in around 52% of the patients, and 47% were RT-PCR positive for COVID. As diabetes was more prevalent, similarly the mean HbA1c levels were also very high, and the other markers of inflammation, D-dimer and serum ferritin, were also above the normal range. Now coming to the staging of the patients, about 50% had stage 3B, in which one or more quadrants of the eye are involved, and 30% were around 3C, and rest of the stages were around 4 to 8%. So these are just few of the pictures showing proptosis and edema and chemosis. In visual acuity, mostly all the patients were having a fairly good visual acuity. Around 80% had between 612 to 66, and less than 60 was around 15%. Proptosis was present in around 13% patients, and the limitation of extraocular movements was present in around 34% of the patients. Coming to the treatment outcomes, this was radiologically, there was around 52% showed some improvement on CT or MRI, and the patients which didn't show any change, or there was a very mild improvement, were taken as stable. There were around 38%, and 9% showed worsening despite giving the injections. So this is an image pre and post TRAMB. So in the upper image, we can see there is involvement at the orbital apex, and the medial rectus is involved, and so this is and in the second image, this is after 1 month. There is a resolution of the disease, and the crowding is resolved, and there is also thickening is also reduced of the medial rectus. The other outcomes involve the improvement in the extraocular movements. So around 30% patients showed improvement in the extraocular movements, and some patients, around 9%, required TRAMB augmentation, and a second cycle of 7 days was again given when there was a worsening on the radiology. And there was a mortality in around 11% patients, and the better thing was no patient required exentration in the patients receiving TRAMB injection. So coming to the complication, subconjunctival hemorrhage was a common complication, but it was still less at around 13%, and 9% patients experienced temporary vision loss. So this is an image of a post-TRAMB complication. So the patient, there was a proptosis and chemosis and decrease in the vision after TRAMB injection, but it was a temporary and self-limiting, and the injection was stopped, and after 5 days we can see there was improvement in the movements also, and vision also improved subsequently. So to conclude, TRAMB can be considered as an adjuvant to standard systemic antifungal therapy, and so it not only reduces the disease progression, but can also be used to preserve globe and sight, and the main thing is that potential excentrations can be avoided. Thank you.
That was a good presentation. I want to ask, what was the criteria of using TRAMB? Like in which, how did you decide exactly which cases you need to
In
give
stages 3B or more, in which there more than one quadrant of orbit was involved on radiologically and as well as clinically also. So
was that the only thing? What about vision?
No, even if the vision was good, but there more than 2 quadrants were involved, then we had given the injection.
And what kind of amphotericin was used?
This was liposomal amphotericin B,
Yeah.
and it was reconstituted with distilled water, and 3.5 mg per ml we have given.
Okay, so you
1
said
ml.
no patient underwent exentration in whichever you gave TRAMB.
Yes, it didn't progress to exentration.
Okay.
So I wanted to ask, after how much time? So this is not switching on. So okay, the light was not on. Okay, thank you. So I wanted to ask, after how many days you assessed for radiological improvement? You have said around 52% had radiological improvement.
So the serial scan was done after 1 week of the injection, and every week till the patient was.
So the pictures which you have shown is 1 week apart
This
only?
one is in 1 month. So the improvement that we saw in the patients, that was at least a month, we can say. So only after 1 month.
And what was the time period when you thought that we'll give another cycle of 7 shots?
No, if there was a worsening on the radiologically, on the CT or MRI, the disease was progressing, then we gave another shot.
Actually, after giving TRAMB, there is already so much inflammation, and because of the drug also.
No, we waited for at least 2 to 3 weeks, because simultaneously debridement is also undergoing, the patient is also undergoing debridement, and so for that also we waited for at least 3 weeks, and it was not like that we have given injection and next there was a worsening. So like 3 or 4 weeks after that only we gave another shot of TRAMB. No patient was given less than 1 month repeat injection.
Okay.
Have you been doing any debridement like with TRAMB?
So that was done by the ENT department.
Orbital debridement?
No,
Nothing.
they only do the.
So either TRAMB or exentration, that is what you mean.
Yes.
So nice presentation, and it is in line with most other studies, but there are a few other points which needs clarification. One is that you said in 9% of the cases they require some augmentation. What
Yes.
do you mean by that?
That sir, repeat cycle of TRAMB for.
So only 9% of the cases required that. That's
Yes.
something
It
very.
means that there was worsening in them.
So that's pretty unusual actually. Most other studies, in them we also gave TRAMB in like in most patients they require more than 3 cycles of injection. The other thing is waiting for 1 month in mucormycosis and then deciding about progression is also a too long a period. Generally repeat TRAMBs are given not more than 1 week apart, because 1 month a time will, I don't
No,
think.
not waiting for 1 month. Like scan was done after every 1 week, and if it is stable or it is not showing worsening, then we withhold that.
Okay, so this is little unusual and not in line with other studies that one single shot of TRAMB will give you so much like.
No, sir, for 7 consecutive days. Each cycle was for 7 consecutive days.
Okay,
TRAMB was given.
okay. So you mean to say one cycle was given
Was for 7 days.
7
Yes,
days.
daily we were giving.
Daily
one
you were
injection.
giving it for 7 days, and then you waited for some time.
Have you in some cases like withdrawn or like 2 injection दिया और इसके बाद नहीं देंगे, ऐसा कुछ decide किया था? Any
No,
criteria?
ma'am, we followed for 7.
So even
So
if the
patient had like some
inflammation,
complication or like in that a temporary vision loss, some reaction, in that cases we withhold it. Or if the patient is on anticoagulants, and those also we were not giving.
All right. So generally, the general trend was that patient never followed a set course as it was there in your study. Generally, like
No,
there were
all the
varied.
patients were admitted patients, so we were following
Mostly
a daily.
patient required exentration also in all the settings. Few of the patients they required exentration. Some of them
So
required.
usually, sir,
All
those
right.
are PL negative cases. They go for under exenteration. That we have excluded.
Okay. Okay.
Yes.
Fine.